So you do a different kind of a crown. You say it's much better than traditional types of crowns.
That's correct.
Tell me about it.
Basically, there are two types of crowns. You've got the traditional full crowns, and which, you know, that's why my husband and I moved away from that school of thought.
Off camera, by the way.
Yes.
You told me, you said you couldn't say one good thing about traditional crowns.
That's correct.
I think.
Yes.
So you don't like regular crowns?
No, because I've seen the devastation that it causes to your tooth structure. You know, this is a living thing.
So what, they have to carve down a regular crown?
You have to cut down very aggressively. And the more you cut the tooth, the more damaging and traumatic it is to the nerve of the tooth. That's why it's not unusual to see teeth that have had crowns need root canals after a period of time. So that's the...
And then they maybe need to be extracted someday.
Then after, yes, unfortunately, it's this, like, we call it the kiss of death. Truly.
You and your husband call it the kiss of death. Okay.
So what you put these aggressive crowns on these teeth, eventually they might need root canals, and eventually the root canals might fail and the tooth needs to be extracted.
All right.
Okay, so our approach, it's called the biomimetic approach to dentistry. And really everything in dentistry and medicine is going towards a more conservative approach, you know, saving this really precious tooth structure. Okay.
All right.
And doing nice conservative
so what,
preparations.
it's a thinner crown?
No, it's not necessarily thinner, but it's much more conservative. You don't have to cut the entire tooth structure down. Okay. You basically put a little hat right where the problem is. Let's say there is a crack in the tooth. You don't take the whole tooth and cut it down. You just treat the problem, which is the crack, or the large filling, or where the cavity is.
Now, I overheard you talking. You say that you have those in your mouth?
That's all I have in my mouth. And that's all patients...
So you would no way get a traditional crown?
I would, no way. No way.
Wow.
And it's interesting because a lot of our patients come to us, and as I'm explaining to them the whole procedure, they really like the concept. And unfortunately, all they have in their mouth are traditional crowns.
Is it a lot more than a traditional crown?
Cost-wise?
Yes.
Not at all.
Then why aren't everybody doing this? Why aren't all dentists doing this?
Because it's a much easier way to do it.
The other way.
The other way. Yes, yes. When we do these crowns, we have to take a really long time bonding them in.
So you don't do any then traditional crowns anymore?
No, I can't say never. There are certain circumstances where you have to. Rarely. Like if you're replacing a traditional crown, then you don't have a choice but to do so.
Okay.
Okay. But if I had my choice, I would never ever do a traditional crown.
And it's better. Do you have any statistics that they last longer than a traditional crown?
Well, the way we're bonding them in, because we don't use traditional cements, we use definitive filling material, which we warm up, and we use that as our cement. So these crowns could last forever. I've tried cutting some of these crowns out, and it's very, very difficult. Very difficult.
So you do some of these too in the practice?
Yes.
Because I know you do a lot of the ortho in the practice.
No,
Your husband does a lot of the dental implants.
No, I do a lot of restorative treatment as well.
Do people prefer dealing, because they're afraid of the dentist?
Yes.
They prefer dealing with a female dentist? It seems like they would.
Well, you know, you have a mix. The kids love female dentists. Yeah.
Okay, yeah.
And some of the ladies in our practice like to have a female dentist. But then there are people who just love my husband and want to see him.
We've had him on the show. He's good.
Thank you.
He's good. So,
he is very good.
So final message, though, to anybody considering a crown.
Yes.
How do you ask for it by name? You just say the new type of crowns? Or
the more conservative crowns, basically.
But in your practice, you call it what?
Well, we call them onlays.
Onlays. Okay.
Onlays, yes.
Okay. An onlay crown.
An onlay crown, yes.